Physiotherapy for pressure sore. Pressure sore is a localized area of tissue necrosis that tends to occur when soft tissue is compressed between a bony prominence and an external surface for a prolonged period. These lesions are also called as bed sores, decubitus ulcers, and pressure sores. Pathophysiology. Various risk factors act on an area of soft tissue overlying bony prominence. When this pressure exceeds normal capillary pressure, then there is occlusion and tearing of small blood vessels. This will reduce the tissue perfusion, will cause ischemic necrosis and pressure sores. Causes: age. Older age tends to have thinner skin, poor nutrition, and delays wound healing. Lack of pain perception, spinal cord injuries, and some diseases cause a loss of sensation. Malnutrition. Pressure sore develop if poor nutrition, especially one deficit in protein, zinc, and vitamin C. Urinary or fecal incontinence, problems with bladder control can greatly increase the risk of pressure sores because skin stays moist, and bacteria from fecal matter not only can cause serious local infection but can also lead to life-threatening complications such as sepsis, gangrene, etc. Other medical conditions such as diabetes and vascular disease. Smoking, in that healing becomes slow because nicotine impairs circulation and reduces the amount of oxygen in blood. Sight, sacrum, greater trochanter, ischial tuberosity, malleolus, heel, fibular head, scapula. While on wheelchair, a pressure sore develops on tailbone or buttocks, shoulder blades, and spine, the back of arm and legs, where they rest against the chair. Feet. Management. Changing position. In bed, change body position every 2 hours. In wheelchair, shift weight every 15 minutes. Using support surface, special cushions, pads, mattresses, and beds. Cleaning. It is essential to keep wound clean and dry to prevent infection. Removal of damaged tissue, oral antibiotics, controlling incontinence, healthy diet, high protein diet, supplements of vitamin C and zinc. Lifestyle changing, quitting smoking, exercise, soft tissue techniques, slow deep effleurage, and deep needling. Scar moved from side to side to prevent adhesion. UVR is to destroy microorganisms and to improve circulation. In open infected wound, E4 dose of UVB or UVC using ultraviolet opaque material for 2 to 3 times a week. In uninfected wound, E4 dose of UVB or UVC 2 to 3 times a week. In edges, E1 or E0 dose of UVB or UVC daily. In shallow healing wound, floor, E1 dose daily, edges are being screened. Deep healing pressure sores, floor, E2 dose twice a week, edges and surrounding skin, E0 E1 dose daily. Ultrasound promote healing, increases vascularity in surrounding tissue, dose of 0.25, 0.5 watt per centimeter square for 5 to 10 minutes to the surrounding skin and with the use of hydrogel sheet to the ulcer area itself. US is contraindicated in presence of superficial or deep vein thrombosis. Laser. It is to increase vasodilatation and to decrease pain at the site of wound. Treatment should be given on alternate days. Exercise. Passive range of motion, active assisted range of motion, ankle pump exercise, strengthening of muscles and joints without impeding the healing of ulcer. Teaching mat exercise or activity, IRR and hot packs, non-immersion hydrotherapy.